Hello, this is take 2 for my first video. I made my first video on why I want to do videos, and then I just watched it now and it was like really boring. So now I'm going to make this second video, and hopefully this one will be better. I am a psychiatrist, and I think I'm coming to this because our mental health system of treatment is totally fucked up and broken. And maybe I just need to talk and scream and vent about that, and I'll be ready to go in for another tour of duty. Or maybe I can share some information that might make it better. I don't know. These videos are for entertainment purposes only. They are not meant for treatment or medical advice. Just don't sue me. So why is our system so fucked up and broken? And I'm coming at this, I've been working in the system 10 years after training. When I say after training, I don't know if you know what that is. So I went to high school and, graduated high school, and all of high school was working and studying and doing all that crazy stuff so I could get into college that I wanted to go to, and I went to college, and then I decided I wanted to go into medical school, but then I got weeded out and definitely didn't finish that all that first time around. But it's long story short, I did 4 years of college and then went and worked for a while in a law firm and decided I wanted to go to medical school. So I went and finished prerequisites for medical school. That was another 2 years, but basically 4 years high school, 4 years college minimum, and then 4 years of medical school where you do everything from dissecting a cadaver and looking at microscope slides and delivering babies, practicing surgeries, all that stuff. And then from there you apply to a residency, and I decided I wanted to go into psychiatry, and that is a 4-year residency. So now if you're keeping count, that's 4 years high school, 4 years college, 4 years medical school, 4 years residency. So 16 years after grade school. And so I did all that, and I've been working kind of as like a full-grown psychiatrist for about 10 years now. And so that's kind of where I'm coming from, because I think we're in a spot where, I think it's safe to say that a lot of people are disillusioned and frustrated with our healthcare system. That's like a pretty I think easy statement to make that I don't have to put a lot of citations on. And I think particularly with psychiatry and mental health, it's been tough. What I will say is that what I've always known about psychiatry is that there's never enough psychiatrists, and there's never enough time, and there's never enough that a system is going to pay for. And so generally, though, a psychiatrist is meant to be trained in all aspects of your physical well-being, your mental well-being, able to do psychotherapy, and able to prescribe medications. What most people just know about psychiatrists is like, you're the guy who can prescribe a medication. And then the second thing I always fucking hear is like, can I get some Xanax or Adderall? And so, it is what it is. I'm not too salty about that, but or maybe I am. So it's I'd say if you're working for someone, if you're working for a university, if you're working for a health maintenance organization, for a hospital, really what they want you to do is prescribe medication. You may try to approach that shit to be like, I'm gonna have a conversation with the patient, do a full diagnostic interview, and prescribe treatment that could include art therapy, exercise, optimizing their cholesterol, and medication, and psychotherapy. And really they'll be like, that's nice. So what medication are you gonna prescribe, Dr. Daley? So I think that's the first thing that's really frustrating, just to share with you that as a doctor, most all of us have gone into this because we want to spend time with our patients and want to really get to know you and get to know the ins and outs of your specific situation. though generally we're not given the time to do that. And yeah, and I'd say more and more the effect that that has had is that as time goes on, more and more psychiatrists who are going into this are just kind of going into it trying to see everything as just a medication. And I'd say it comes from both sides. I'd say more and more psychiatric medications are like the number one moneymakers in really, like, Google it, like shit for depression, anxiety, insomnia is all in the top 10 of pharmaceuticals prescribed. So all of that direct to marketing advertising has the effect of people come to you and they generally want a medication, and they are not going to be happy with you if you say, like, I don't think a medication is going to be helpful. Most of our systems now have like a rating system where, you know, I'm like an Uber driver or like a DoorDash delivery person, and I rely on you to give me a 5-star review or I might not get promoted at my job. So it's those confluence of factors, or family members who are concerned, you know, rightfully so in many cases, but really want you to medicate their kid or their mom or their partner. So there's all of this, and generally you're working in a system that wants you to see minimum of like 6 to 8 hours per day of psychiatric patients. You know, my last job, it was usually about 15 patients a day. And I think for like a pediatrician, that sounds like very little, or an emergency medicine doctor, but it's fucking impossible to, you know, to have that, to have genuine empathy, connection, emotion with your patient when, I mean, honestly, after number like 6 or 7 in a day, it's like, it's very tough. And there's generally the time in your session, you know, it's about, it's usually, you know, maybe an hour booked for a first session and a half hour for a follow-up session, if you're lucky in a good system. And that hour can seem, the hour definitely goes by fast. And I will say, just, you know, when I was in training, we would have usually about triple that amount of time to make a diagnosis spread out over 2 to 3 weeks to really kind of get to know like this person and what all are the factors involved, and to present options to the person to be like, here are your treatment choices. You could do cognitive behavioral therapy, you could do medication. Within medication, you could do option A, option B. I noticed that you are kind of drinking alcohol like a lot, like, could we talk about that and maybe have some options for that? And, you know, these are the labs that we, so to do all that, it's really, there's the time allotted is never enough to do all that. So you're always working in sort of like this cyclical system to kind of like do enough to like move the ball a little bit further down the field during that visit, but it's never enough. It's always like just that amount. And if anything fucked up is going on, like, God help you if you know, somebody's going through a crisis, or, you know, starts crying, or like their mom just died, it just sucks, because, you know, I'm like a human being, and I went into this because I'm pretty empathic, but like in that session, I am meant to, I'm like, oh my fucking God, like this person's mom just died, and yet I know I have 6 more patients after this, and I have to try to artfully re-steer the conversation back to, are you having any side effects from your Prozac? And like, I'll see you again in 3 months, and here's like a number for a grief group. So it's tough all around. And I've been on the flip side as a patient, and from that perspective, it's totally fucked up too, because so often you're going in and you're kind of bearing your soul, and you're like, this first time I've ever admitted that I have sadness or depression, and you're crying. And most times I think what happens is the doctor's like, oh, I'm so sorry, here's a pill, take this pill, and that's it. Like, that's the end of the conversation. You're like, oh, are there any side effects? Nah, not really, it's fine. You know, just take this Lexapro and you'll be fine. Or take some samples, you know? So I think on both sides, it's pretty fucked up. So yeah, that's a lot. So bringing it back from the venting to be like what can be helpful. I think that being said, there are some basic things that I'm hoping I can kind of share in some of these next videos. Things that I found myself telling patients over and over, just little pearls, little tips, tricks, like little like life hacks and things like that, that I think can help. And I think, when I've stepped back from that, like the flip side, there's a lot that can be done these days on a platform like YouTube or a platform like even just like Wikipedia. So I'm hoping that some of this information I can present can be helpful too, and I certainly don't want to make it seem like there aren't really good doctors, and I'm really glad that there are systems out there to kind of help people. I think we're in a little bit of a fucked up time where there's so much of a volume of people needing mental health treatment, and every place I've worked is just this tension of, am I gonna work an extra 2 or 3 hours every day and still try to have a life, and how do I have a life with that, or how do I stay in this work without burning out? So that's where I'm coming from, so stay tuned.